Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 28 new cases of COVID-19 in Windsor and Essex County. Of the 28 cases, 10 are close contacts of confirmed cases, 7 are community acquired, and 11 cases are still being investigated. We have had 13,837 cases since the beginning of the pandemic. 13,143 cases are now resolved, and 291 people are active at this time. There are 69 preliminary or confirmed variants identified in Windsor-Essex. 19 cases are currently in the hospital and 5 people are in ICU. Our community has lost 403 people to COVID. I'm sorry to report that a man in his 60s from a long-term care home passed away yesterday. There are currently 10 active outbreaks in Windsor and Essex County, 5 workplace outbreaks, 4 community outbreaks, and 1 school outbreak. There have been a number of updates to the regulations for areas of control under the Reopening Ontario Act. Recent amendments include adjustments to the outdoor capacity limits for weddings, funerals, and religious service rites or ceremonies. Specifically, outdoor capacity limits have been adjusted effective March 29th to the number of individuals that can maintain physical distancing, previously a maximum of 100 outdoors. 30% capacity still in place for indoor. This change applies to the service, not applied to social gatherings. Recently, the health unit has investigated several clusters of COVID-19 associated with funeral attendance. It is important that residents gathering for a funeral adhere to all public health measures. This means keeping a 2-meter distance at all times from those not in your household, regardless of mask use. All attendees must wear a mask, sanitize or wash hands frequently, and stay home if you are sick or have symptoms of COVID-19. The loss of a loved one is a difficult time. Coming together can be an important part of the grieving process. It is critical to remember that gatherings for any purpose increases the number of potential close contacts you have and your risk of COVID-19. It is important that residents remember to adhere to public health measures to keep themselves and their families healthy. To review current guidance and restrictions for regions in red control, visit our website at www.wechu.org, wechu.org, and click on the red control button at the top of the page. Now for our vaccine update, a total of 87,489 doses have been administered to Windsor-Essex County residents. On Friday, we announced that residents 70 years of age and older are now eligible to receive a vaccine through one of our targeted vaccination clinics. New appointments are added daily and there are still spots available, so please check it regularly. To book, simply go to www.wevax.ca to book your appointment. If you do not have a computer or need assistance with booking, you can call the booking number at 226-773-2200. With support from the City of Windsor and Windsor Regional Hospital, booking agents will answer your call and assist you. We have received some questions about the Leamington Vaccine Clinic. Please be advised that the vaccination clinic is not closed. There are schedules for Leamington and Amherstburg. So if your preferred location is in Leamington or Amherstburg, just check back regularly on our scheduling system for dates and available times. Residents 60 years and older are still able to book at selected local pharmacies based on supply. To find a pharmacy, please visit wevax.ca. Please note that all bookings are for first doses only. For general inquiries regarding vaccination, please call 211. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning. Yesterday, the National Advisory Committee on Immunization, NACI, updated their COVID-19 vaccine guidelines to recommend that AstraZeneca COVID-19 vaccine should not be used in adults under 55 years of age at this time. While the safety of this vaccine is investigated further to understand the risk of clotting in younger age group who received the AstraZeneca COVID-19 vaccine. NACI updated their recommendations after receiving reports from Europe on rare cases of serious blood clots, including cerebral venous sinus thrombosis associated with thrombocytopenia. These cases were identified so far primarily in women under the age of 55 years. Although cases in men have also been reported, the exact mechanism by which the AstraZeneca triggered this event is still under investigation. At this time, no other risk factors have consistently been identified in patients who develop this condition. This adverse event has not been identified following the receipt of mRNA-based COVID-19 vaccines such as Pfizer and Moderna. To date, there is no case of these rare adverse events have been reported in Canada. Given the emerging evidence on these adverse events, it is important to be transparent and share the available information to help everyone make an informed choice. Canada has seen a large number of people 60 plus dying with COVID diagnosis, and this rare adverse event is only noted in individuals younger than 55 years. NACI concluded that benefits of getting a vaccine outweighs the risk for these adverse events in individuals 55 years and older. The NACI will share additional details on data as soon as it becomes available to update or change their recommendation. In Ontario, the AstraZeneca vaccine is only available for individuals 60 years and older. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, Doctor. Good morning, Teresa. Teresa, you mentioned a few clusters associated with funerals. Can you give us a sense of how many cases have been associated with funerals recently?
I don't know the exact number of cases. I should have looked at that, but I do know that we were investigating 3 different clusters, 3 different funeral events that did produce cases and further spread. So I just don't have that because it just didn't happen. It was over the last few weeks.
Okay, and I mean, funerals are a very difficult time. Should people still be having these funerals if they can't stay away from one another? Or can you talk more about your recommendations?
Well, I think the recommendations are just to adhere to the current protocols. And you're right, it's really difficult when you're together not to comfort someone by moving closer and closer. But having a mask on is not necessarily the only measure. It's the distancing as well and adhering to those limits and not gathering afterwards. So it's not necessarily one aspect of the funeral. It's the gathering part of it, having people in close contact and gathering afterwards as well.
Does it seem that during any attendance at funeral homes, the organizations are following and enforcing those measures properly, or is it more that individuals maybe after they leave those centers are having other gatherings inside?
Yes, it's not necessarily the funeral home situation. It's the social gatherings afterwards.
Okay, thank you.
Any questions from AM 800?
Teresa, I guess to that point, so once the health unit determines there is a cluster or potential cluster, does the health unit staff go into these funeral homes? I know, like you just mentioned, it's happening after the funeral in social gatherings, but does your team, your staff go to these funeral homes just to make sure?
Well, we do investigate, and they do look at practices in the funeral homes and follow up with cases and contacts and the events that occurred. But the funeral homes do have good practices in place, so I don't want you to think that it's a lapse in infection prevention and control practices at that point. But it's the fact that people are gathering, and it's hard to maintain that distance when you're trying to comfort someone. So I think it's just a natural, humane response. And, you know, people gravitate to support each other.
And like you mentioned, this has been ongoing for the past few weeks. With the pandemic going on for more than a year now, is this the first time the health unit is noticing certain clusters, I guess, from funerals?
No, it's not the first time. It did occur last year at with several funerals, and you know, so we have seen it on occasion. And I think right now it's just a good reminder that if you are attending a funeral, that you should stay home if you're sick. You know, do that COVID screen. If you have any symptoms, just stay away. And if you do attend, you know, put on the mask and maintain that social distancing and adhere to the public health measures.
Thank you.
Any questions from CTV?
Yes, Brian. I talked about AstraZeneca. I guess now that the National Advisory Committee says people under 55 shouldn't get it, what is your message to the people in Windsor who have gotten it that are over that age range?
Well, I think to date, there is no report of any adverse event in Canada, and these events are primarily in younger population, 55 years and under. There are some symptoms that has been identified that people, if they are developing those symptoms, such as shortness of breath or any persistent symptoms post-vaccine up until 20 days, if they're experiencing those symptoms, then they should contact their doctor just to make sure that they are not experiencing any of these rare events. But generally, most people connect with your healthcare provider if you develop any symptoms.
And what is the plan for the leftover AstraZeneca as the expiry date approaches?
So there has been some conversation and discussions happening at the ministry level, and some of these vaccines, we understand that it would be redistributed or will be shared with the primary care providers. And I don't have the details at how it is happening, but that discussion is happening at the provincial level.
I noticed there's a jump in 10 variants today from yesterday. Is this just results coming back, or is this associated with the cluster?
I don't think that it's associated with the cluster. I think it's just the results coming back, which all of these tests are now being tested for the variant of concern, and it's just reported as soon as it becomes available to us.
Okay, thank you.
Any questions from CBC?
Yes, I have one question related to AstraZeneca. Given the policy not to give the vaccine to people under 55, is the health unit, will that have any impact on our vaccine rollout overall? Like, is the health unit looking at diverting the vaccine to the mass vaccination clinics so that the Pfizer Moderna vaccines can be reserved for young people when the prioritization list gets to them? Or do you anticipate that that won't be an issue at that time?
Well, we can't say what would happen in the next weeks or months with respect to new emerging evidence that would come based on all the assessment that's been happening around the world. It's hard to predict. We have a small proportion of AstraZeneca vaccine in our overall vaccines that we have in Windsor-Essex as well as in Ontario. It would have an impact, definitely, because when we are counting on these vaccines, then we're hoping that it would be available for everyone, and hoping that we'll get more clarity whether this vaccine is safe enough to use in the younger population or not, or when the other vaccines such as Janssen or Novavax or other vaccines that are currently under being reviewed will be available to us. Our plan is based on the Pfizer and Moderna for the mass vaccination clinic that will continue to happen, and we'll continue to look at the evidence when it becomes available for the rest of the population group as we move forward with more evidence coming out from AstraZeneca adverse events.
Thank you.
Any questions from Blackburn?
Yes, good morning. I'm not sure if you can answer this, but the individual who passed away, you said he was from a long-term care home. There are no current homes in Outbreak. Is this somebody who has been in the hospital for quite some time?
Yeah, this particular individual had a long history of illness and had been hospitalized back and forth a couple of times, and had a number of medical complications attached to the medical history.
Thank you.
Any additional questions from the Windsor Star?
Just Maureen's question, but even though this individual had other comorbidities, COVID-19 is still resulted in this death?
Well, I think the way the deaths are reported, it's if after a certain number of time, like after a certain period of time, if the individual passed on with a COVID diagnosis, they're all reported as COVID-related deaths, and that's how it's being captured and being reported right now.
Okay, is it reasonable to say that COVID-19 was the initial reason that the individual was hospitalized?
Yes.
Okay, thank you.
Any additional questions from AMA 100?
Two more, one for Dr. Ahmed and one for Teresa. Dr. Ahmed, just in regards to schools and the April break, I believe the Premier hinted that it could be changed again. Does the province or the ministry reach out to the health unit to get recommendations to see what's happening in Windsor-Essex and our schools? I know there's cases and there's the one outbreak, but does the province reach out before making a decision?
Not yet. I haven't provided any specific details on the school-age children at this time, so I haven't provided any update.
Thank you. And one final one for Teresa. Teresa, I know I asked you this yesterday, but I was having some recorder troubles. Can you just tell us the plan once again for the vaccination sites over the Easter holiday weekend?
So on Friday and Saturday, the vaccination sites at WFCU and the county, I'm not sure if it's the Nature Fresh, they will be open, as well as the Sportsplex and the downtown one. The WFCU and Nature Fresh in the county and Libro will be closed on Easter Sunday and Easter Monday. But the Sportsplex and the downtown sites will remain open for vaccination. Is that clear?
So if someone goes on the booking system, it'll be blocked off on those certain closure dates?
Yes, they won't have the ability to schedule an appointment on the Sunday or Monday at those locations. That's correct.
Thanks, Teresa.
Any additional questions from CTV?
Yes, just one more. The person who died, was he vaccinated?
I don't have that information right in front of me at this time.
No problem. Thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Okay, thank you everyone. Have a good day.